Domestic violence has been on the increase. We've been told that we should expect more. There are financial problems in homes, and people are having to deal with loss of jobs or having pay cuts, and all this is all because of coronavirus. So today the question is, how is this impacting relationships? How is it impacting families? The initial plan was to open up our phone lines for you to send in your questions for our psychologists to help you answer those questions. But unfortunately, we'll have to just have a conversation with psychologists as we sample the problems they have already received, and then we carry on the conversation next time. So I do have on Zoom with me Dr. Emmanuel Esampong. He's a clinical psychologist, a senior lecturer at the School of Public Health, University of Ghana. He's also a member of the COVID-19 response team. Doc, thank you for your time this afternoon.
Thank you for having me.
So I understand already you've been receiving some requests for assistance as far as psychological support is concerned. What sort of requests are you getting exactly?
Right, so mainly these requests have bordered around people having to deal with the anxiety and fear associated with the disease. There are also instances where people think that for them, it's not something that is closer to them, and so observing the measures that have been put out there, more like a problem for them. Issues of stigma have also come up, and then how best we can actually go about this whole thing, said that the responses, that have come from different places, will be appropriate. So to a very large extent, I would say that a lot of the issues that have come up have bordered on, people's emotional stability and how well they can cope.
And that's a very important thing, emotional stability. I mean, sometimes you may look down on it, but you may take it for granted even. But it has a whole impact on you. I'm not a psychologist, you are, so you can even help us with more. But before we go on, can you share with us one or two of those very unique stories that you have heard in these requests as they come to you?
Right, so I think that the very recent one has been people, saying that for them, they don't really believe that there is anything, called COVID-19. I mean, they haven't seen anybody having it, and so if it happens that they are being asked to, as it were, follow the, the protocol that have been put out there, it's as if it's a problem for them. I mean, wearing of their mask, for example, somebody thinks that, because of the names that people have actually associated with the mask, some calling it a mouth diaper, some also saying that it is a brazier for the mouth, all those things. So they are thinking that, well, they are not going to step out there wearing these things for people to, as it were, call them or refer to what they are wearing by those names. And the thing is, more like trying to correct the impression that they have about, doing some of these things. The reality is that this is a new disease. We have not got, much information about, how people can be infected apart from what we already know.
Yeah.
And so, I mean, in the right senses of the scientists, they have come up with very simple measures that, we all need to follow. I mean, I'm saying it's simple because then, bottom line, if you know that you don't have anything to do out there, then you stay put in your home so that, I mean, there won't be the need for you to, be wearing the mask, be washing your hands and, all those things. I think that is what, people should be looking up to, instead of stepping out there and not wanting to do, follow the measures when they actually may give the disease to somebody or they may contract it from somebody.
Now, talking about wearing of masks, I mean, the President of the United States, Donald Trump, is one of the biggest people who think that wearing of the mask is not necessary. In fact, he calls it a political hijab yesterday, because he had one, but he didn't want to wear it for the media to capture, for other people to see. And for people who think that they don't want to wear the mask because they haven't seen anybody with it, is there a problem? I mean, psychologically, would you say, what is going on in the minds of people who think like that?
Well, I'm hesitant to say that these people have been any psychological problems, when I have not encountered many of them.
Okay.
What I think really is that it's as if the information that we are putting out there, it's coming from the top to the bottom. And you know that, the cultural context that we find ourselves in are quite unique. And if somebody at the top, already people have all kinds of perceptions about people at the top.
Okay.
So the thinking is that perhaps we did not resort to the right community engagement.
Okay.
Because I have argued that in every community there are people who wield all kinds of influence, people who have power, people who have authority, said that these people, when they put out anything, the community people are more than ready to accept it. So having gone into the community right, how are we able to identify these people, educate them on what exactly we want community members to do? And then they are the ones who are putting the information out there. And the interesting thing will be that these people are also in the community. And so once they put out the information, the expectation on their part will be for these people to adhere to that. But if it is that it is coming from the top, then it becomes a bit difficult for people to easily accept. And there are certain people in the society who, for them, not until the thing has really gotten to them, they will always doubt that there isn't anything like this.
Yeah, it's interesting. Perhaps next week we'll be able to open up the phone lines and have people calling to you. But you're part of the COVID-19 response team. So based on what you have received, the request that you have received with the anxiety, the fear, the denial, the stigmatization, and the obvious impacts these will be having on the family and relationships of these people, we can delve into this deeper next time when we have this conversation. How have you responded to these requests that have come through?
Great. So this COVID-19 response team is specifically, located at the School of Public Health, University of Ghana. So again, there's been a lot of misinformation about COVID-19. We have had the opportunity to, as it were, provide appropriate information to people via, a Telegram app. And then over time, we also realized that issues of stigma were coming up strongly. And so, we put together a team that quickly developed, some training module. And last week, Tuesday, I think on the 19th or so, we gave the opportunity to media practitioners, journalists, who took part in a Zoom training on how to communicate, issues related to COVID-19.
Okay.
Let me say that this was a very successful one. I think we extended the invitation to multimedia. Unfortunately, I didn't see any of your people joining, but this was a very good, yeah.
We'll certainly come for the feedback if no one represented. I'm sure it must have been an oversight because we always respond to some of these calls. But Doc, it's a very good time to wrap up on the conversation for today. But like I said, next time we can have this conversation, and if that's okay with you, we'll open up the phone lines and have people ask the questions that about how this is impacting their relationships and their families, and we get some help for them.
That would be well.
Thank you so much for your time this afternoon. I've been talking to Dr. Emmanuel Esampong. He's a clinical psychologist, senior lecturer also at the School of Public Health, University of Ghana. He is a member of the COVID-19 response team. So do not be burdened by anxiety. Don't be in denial. Don't fear, but do not also be in denial. This is real. People have died from it. It is real. And then do not stigmatize. For emotional stability, work on it. And next week, we'll try and have a conversation, see how we can help with that.